The next speaker is Khor Hui Min et al. With the title Falls and Hospitalization Among Older Adults Attending Memory Clinic in a University Hospital. Please.
Thank you very much. So this is actually an effort from the geriatric unit to try and come up with a dementia registry, and this is just partially what we've got so far. I'm presenting on behalf of one of the medical students who did this as her elective, and she couldn't come because Norway is a little bit too far for her to come. So basically just to highlight that patients with cognitive impairment or dementia are definitely at higher risk of osteoporosis, they are higher risk of falls, and they are higher risk of developing hip fracture. And one of the risk factors for falls in older people with cognitive impairment could be because of their behavioral and psychological symptoms of dementia, as mentioned here. And we know that older people with cognitive impairment are also at higher risk of hospitalization. And because of falls, hospitalization, all these adverse health events, it increases the stress of the caregivers as well. So this is just a picture of the hospital that I work in. It's University of Mayala. We have a memory clinic that we run, and I think for a year we have about 1,144 visits of about 750 patients that comes in each year, and that's our data for 2022. So the objective of this study is to look at the predictors of adverse health outcomes, which is falls or hospitalization, among older persons attending the memory clinic in University Hospital in Kuala Lumpur. So what we did was that this was mostly cross-sectional retrospective study, and we included all the patients that attended the memory clinic in 2022. And the patients that we've looked at particularly are those who actually came back for follow-up visits in 2023 up to July. And the data that we look at would be the usual demographic data, the residents, where they live, their comorbidities, their history of previous falls in the last year, as well as history of any fragility fractures. So dementia assessment, we actually looked into their MMSE score, the presence of any behavioral and psychological symptoms of dementia, and functional assessment, we looked into the CARDS and also the Lawton assessment of daily living. So adverse health outcomes were any occurrence of falls or hospitalization following their first visit in 2022. So this is our preliminary results. Out of 750 patients, the ones who came back for follow-up visits were about half of them, 355 by July in 2023. And out of that amount of patients, we found that 22 of them reported having had falls, and about 43 of them had hospitalization. And the average follow-up period was about 32 weeks. So this is just what we found so far, and the difference between those who had adverse events and those who did not have adverse events. And you could see patients who had ischemic heart disease had a higher risk of adverse health events, as well as those with a history of falls. And if you look at the BPSD symptoms, none of it was significant, as well as there's no significance either in the degree of their cognitive impairment or their functional status. And when you look into the multivariate analysis, we found that patients who had chronic lung disease, those who have ischemic heart disease, and a history of falls were predictors of possibility of adverse health events such as falls or hospitalization within the next 1 year that we've seen them. So if you look particularly at hospitalization, we did a hazard ratio analysis of them. And when we put in all the p-values of less than 0.2, we found that ischemic heart disease is still one of the strongest predictor of hospitalization. And there you could see the Kaplan-Meier curve on your right. So in conclusion, what we find is that at least 1 in 6 older adults with dementia suffered from either falls or hospitalization over that 32 weeks of follow-up period. So the behavioral and psychological symptoms of dementia, functional status, or even the severity of dementia were not associated with these adverse health outcomes. However, chronic health problems, as well as history of falls, has stronger influence in the adverse events in older people with dementia. And that's all from me. Thank you very much.
Thank you very much for a very nice presentation. We have time for 1 or 2 questions, so please. Yeah, Morag?
Yeah, we actually did, but I decided not to present it. Yeah, I mean, the reason is because when we look at the dementia subtype per se, we didn't find any significant difference between any of the subtypes. But then again, it depends on the clinician's diagnosis of the subtypes. So we found that the diagnosis can sometimes alter. You know, when you have, I mean, our patients are seen by a team of consultants, so you don't get to see the same clinician each time. So at times we find that, you know, vascular dementia becomes mixed dementia. So that's why we didn't find that there was a difference. Yeah. So it was easier to look at just the severity of dementia.
Okay, thank you.
Thank you.
So the next presenter is Louise Kent.